Hi, Mr. Griffey. My name is Paula Brown, and I'm going to do your ear, eyes, nose, and throat assessment today. How are you doing?
Good.
Good, good. Previously, we did the eye exam with the Snellen chart. Mr. Griffey was 20/20 with corrective lenses. Mr. Griffey, we're now going to do the Rosenbaum test. I want you to read the lowest line for me on that chart that you can.
All right. 4, 2, 8, 3, 6, 5, WEM, OXG, 6, 3.
Very good. Okay, so Mr. Griffey is a 20/40 with corrective lenses, according to the Rosenbaum chart. I'll go ahead and take your glasses from you, Mr. Griffey. We're not going to need those right now. We're going to start first, just look straight ahead for me. We're going to start first with just observing and inspecting his eyes. We're going to look at the brows on both sides. They are symmetrical. There's no crustiness or redness. And we're looking to make sure that the eyebrows extend out to the outer canthus here. So everything is fine. Go ahead and close your eyes, Mr. Griffey. I'm going to just palpate your eyelids. Any pain or tenderness there?
No.
Okay, you can go ahead and open them. I'm also observing for the eyelashes that they're growing outward, and they are. When I look at the lacrimal ducts, they both look fine. There's no abnormalities or drainage. I'm going to go ahead and look inside the eye at the sclera, and both of those are white with some small capillaries, which is fine. When I pull down on his eyelid, I see the conjunctiva, and that's a nice pink in color and very moist. Okay, so what we're going to do now is we're going to do the confrontation test, and that's going to check Mr. Griffey's peripheral vision. So what I want you to do, Mr. Griffey, is I want you to put this hand right here over that eye. I'm going to get close to you, and I want you to tell me when you see my fingers come into your peripheral.
Yes.
Very good. Let's go ahead and cover the other eye, and you tell me when you see my fingers come into your peripheral. Yes. Very good. So that was normal. Okay, so now I'm going to look into Mr. Griffey's eye. Okay, very good. And what I'm looking for is I was looking for lens clarity. I was looking for the macula to be normal. I was also looking for the blood vessels to be not hemorrhaged. Everything was fine with those, and his irises and pupils were fine. Okay, so we're going to do another eye test, and what I want to do at this point, Mr. Griffey, is I'm going to shine this light right on the bridge of your nose. This is going to give me some indication as to how your eyes respond. Okay, right on the bridge of your nose there. Look right at my nose. And there's no nystagmus. Everything is fine. There's no wavering or quivering there. And I'm going to check to make sure that his pupils respond to light and are equal. Look straight ahead, Mr. Griffey. Okay, and they're perla there. So everything is fine with his eyes. Now we're going to move to Mr. Griffey's ears. I'm going to palpate the auricles here and inspect those, and they are exactly as I expect them to be given his stated age. Any pain or tenderness?
No.
Mr. Griffey? Any pain or tenderness back here
No.
on your mastoid bone? Okay. So I'm going to look at the ear canal, and the canal itself looks fine. There's no erythema, no drainage. So I'm going to look inside, and I do see the tympanic membrane here. It is pearly gray in color, and the cone of light was at 7 o'clock. As I come around him, I'm going to look in the other ear. And that one has quite a bit of cerumen in it. Couldn't see the tympanic membrane real well, but what little bit of cone of light I did see, it looked like it was right around 7 o'clock. When was the last time you had your ears checked, or have you ever had them flushed?
No.
No? Okay. Okay, so we're going to do a couple things here to check your hearing, Mr. Griffey, and one of them is called the whisper test, okay? So what I'm going to do is I'm going to come behind you, I'm going to plug this ear, and I'm going to say a word, and I want you to tell me what that word is. I'm going to plug this ear, Mr. Griffey. Please tell me what this word is. Okay, so I know by Mr. Griffey's history that he is hard of hearing. He wears bilateral hearing aids, and he does not have those in today. So it does not surprise me that Mr. Griffey has not been able to pass that particular test. What we're going to do now is we're going to do what's called the Weber test. Mr. Griffey, I'm going to strike this, place it on the top of your head, and I want you to tell me if you hear it equally in both ears.
No.
You can't hear that in both ears?
No.
Okay. Now I'm going to do the RIN test, and this is to check air and bone conduction. So I'm going to put on the back of your mastoid. You tell me when you no longer hear it.
No. No.
Let's do the other side.
No. No.
Okay, very good. All right, so now we're going to move to the nose. As I look at his nose, I see that it's very well shaped and formed. There is no lesions, any abnormalities. I'm going to go ahead and look up inside, Mr. Griffey. No deviated septum, mucosa is pink, everything looks to be fine. So that checks out well with your nose. We're going to move on down to the mouth now. As I look at the, please keep your nose closed. As I look at the exterior, I see that the lips are moist and pink. No issues going on with that. Okay. Go ahead and open your mouth, Mr. Griffey. As I look inside there, I see the mucosa is nice and pink. He is missing several teeth. He does have a bridge on the upper, so it's hard to assess the hard palate. Okay, now I want you to stick your tongue out for me and say ah. Okay, that's very good. The uvula rises and falls. I'm sorry, the soft palate rises and falls, and the uvula was fine. He still has his tonsils, and they are 0. Go ahead and stick out your tongue, and I'm going to check your gag reflex. Okay, very good. Okay, well that is the finish of our assessment here today. Mr. Griffey, I certainly appreciate you coming and seeing
You're
me.
welcome.
And you have a great day. Thank you.